Well, as you know, New York City was really hit by a COVID wave. I call it actually a COVID tsunami at the beginning of March. And New York Presbyterian Hospital was really the center of it. Just to put things in perspective, we admitted the first COVID-positive patients on March 7th. We stopped doing elective surgical cases on March 13th. We stopped doing time-sensitive cases on March 20th. And all this to be just one step ahead of the crisis. And we reached peak April 12th with 550 patients COVID positive in this hospital and 220 of them on ventilators. You know, a lot has been said about the lack of PPEs and ventilators, but one story that I don't think has been adequately told is that physicians all of a sudden found themselves to care for patients in areas of the hospital which were overwhelmed by COVID patients and in areas where probably we were not all that familiar. The emergency room, the medical floors, the ICUs were completely overwhelmed by the influx of COVID-positive patients. Weill Cornell asked me and another chair to lead a task force for the redeployment of physicians, staff, and residents, and in the end, we ended up redeploying 360 physicians, staff, and residents to areas they were unfamiliar with. And I have to say that culture of collegiality that we have in this institution really helped tremendously in this difficult and challenging task. New York Presbyterian Hospital asked me to be part of a group of physicians who would make sure that the resources that we had were appropriately allocated. All this on top of the fact that I was leading our department through these very challenging times. It was really challenging both on a personal and on a professional level for everybody involved. It seemed that every day there was a different crisis to address. To put things in perspective, we have about 120 ICU beds. At a certain point, we ran out of ICU beds, if not for the alacrity with which we created new ICU beds. At the peak of the crisis, we had 220 patients on ventilators, 220 patients, therefore, in ICU-like facilities. We made ICU beds out of operating rooms, out of preoperative space, out of postoperative spaces. And everybody really worked tremendously in creating these ICUs that didn't exist 2 or 3 weeks prior to the time. So it was really challenging on everybody. We also felt that we needed to maintain our responsibility towards our non-COVID patients. To this point, we maintained our lines of communications with them through telemedicine to avoid emergency room visits and office visits, a time when really they didn't want to come into the hospital, and we didn't want them to come into the hospital unless it was extremely necessary. I really feel extremely proud and well about the department and the faculty and the residents and the staff.
So I elected to pursue a global health and global surgery research fellowship during my 2 years of research from 2017 to 2019, and the department supported me and funded me fully on that. Gave me the opportunity to work at the World Health Organization for a few months to get a master's in public health and to work on health systems in India and Pakistan and other places around the world. And it was that experience that I think when I came back here and came back to surgical training actually set me up really well to take a leadership role during the COVID crisis. Today, I got pulled out of clinical work and I turned into this operations person. And so I worked the emergency leadership team and was on a daily conference call where we talked about what was going on each of the hospitals and what was the overflow numbers at each of the hospitals and what were the COVID admission numbers at each of the hospitals and how could we work as a system to get things like PPE to places that they were needed. Dr. Mikolassi actually was very supportive of my role. He saw that I had had some experience in this and helped free me up so that I could help at the hospital system level to deal with the disaster management side of things. And I did that for a month as we sort of peaked in the end of March and early April. When I stopped that, I came back and jumped right back into the ICUs and into that line team, as well as seeing emergency consults, because even as COVID was happening, there were still surgical emergencies. Appendicitis happens, trauma still happens, even in the midst of a shutdown. And so we needed people who were helping with that, and I did a number of night shifts, taking care of patients that had surgical emergencies as well.
Through the wonderful guidance of our department chair, Dr. Fabrizio Mikolassi, and by working with my colleagues in trauma critical care, I was able to lead a team that we called the Communications Liaison Service. And we were a group of surgeons that came together to provide support to the Department of Surgery, Critical Care, and Trauma surgeons that were overseeing the direct care of the COVID patients. Of course, there's a no visitation policy because of the need to socially distance and to isolate. And so these critically ill patients with COVID pneumonias, often on ventilators in ICUs, such as the surgical ICUs, but couldn't have visitors, their family, loved ones, couldn't be with them at these very difficult, challenging times. And we're all in the midst of this awful isolation. These families really had huge needs in terms of being able to understand what was happening with their loved ones. So I and my colleagues on our communications liaison service tried to fill that gap, thereby leaving our critical care in the Department of Surgery colleagues available to provide bedside care that they needed to provide. So our role was to make rounds with the ICU teams every morning. This was a 7-day-a-week endeavor. And then after those rounds, which take, 4, 5, 6 hours every day to get through each patient and sort out the many problems and issues, challenges that each of those patients have. After those ICU rounds every day, we would spend another several hours calling the families of these patients to give them updates on exactly what was happening with their loved ones. I remained good friends with many of the families that I got to know during those several weeks that we were getting through this experience. So it was a real privilege to participate in that endeavor.
Well, I saw the Department of Surgery respond to the COVID crisis with alacrity and determination. I saw the entire institution respond to COVID with alacrity and determination. We had faculty meetings by Zoom every day for a period of time, or every other day. That brought everybody together. And in one of those things, it came up that it was hard to talk to the families because the families couldn't come in and see the patients, and the patient care teams at the unit, they were busy enough that it was hard to have any kind of talk with them, and you didn't sit down with the family and couldn't build a rapport and so forth. And so Dr. Newman and I think independently decided, well, why can't we do that? I have, a big background in critical care, so I could understand what was going on. I could then be a resource to the patients. So we devised a system where we would go on rounds. She actually was in rounds. I participated virtually. And then after rounds were over, we would call the family and spend whatever time it took that the family wanted to talk about what was going on. And Dr. Newman and I did that, and that became, for many of the families, a real lifeline to the patients. I was proud of what the institution did. I was proud of how it came together, how it responded, and how the hospital and the medical college really worked together.
The department is proud of the efforts during the pandemic. There is a sense of accomplishment, a sense that we quickly reacted and turned into what I call a Delta force, fighting this most deadly virus. We had losses among patients, and as I mentioned, among our faculty. Now it feels surreal, like at the end of a conflict, where you have been able to hold the enemy at bay. In practical terms, we have become very familiar with making the hospital and our offices safe, with social distancing, and with impeccable cleanliness. It is as safe now to come into the hospital as it was pre-COVID. Yet at the same time, we have become familiar with telemedicine as a way to increase patient convenience and our geographical reach. The Department of Surgery is a very special department with strong core principles and values. I know that they've been maintained and actually strengthened. Well, while 2020 has been a year of great turmoil, we remain committed to our missions of providing exceptional care while training the best and the brightest surgeons of the next generation, along with pursuing new discoveries. We're truly grateful to our donors for all of their support. I look forward to staying in touch with them and keeping them appraised of what we will achieve with their support.